So before we get into actual menopause, we want to talk about perimenopause, the years immediately before we start to have menopause, right? So these are the years leading up to your menopause, and usually it lasts between 2 to 5 years. All right. So after 40, the estrogen in the ovaries produce start to fluctuate. That doesn't mean you start to go into menopause at 40, but your body start to have changes from then. So a common sign of perimenopause is menstrual cycle changes. Sometimes your periods can be a little bit longer, or can be even come shorter, or you start to miss skip months. The amount of flow may become heavier or lighter, and although changes in the menstrual cycle in this case is normal for the perimenopause, anything you still see anything abnormal or any change, you still have to report it to your doctor, because perimenopause is what you call a diagnosis of exclusion. I mean, you have to rule out the things that are more sinister, or things that are not good. For example, if somebody comes with changes in the menstrual cycle, want to make sure that there's no signs of cancer or anything like that before you say, okay, just spend a perimenopause. So what are the changes um, in the perimenopausal period, or the early menopausal period? So this will answer the question that was just asked. So some women actually have no symptoms in the menopausal period, which is very good for them. Um, and some have mild symptoms, and some have very strong symptoms. All right. So other things that can happen, are common things, are the hot flashes. When your body suddenly feels hot, and the heat rushes to your upper body and face, a hot flash may last for a few seconds to several minutes or even longer. Some women have hot flashes few times per month. Some have it more than once per the day. Others have it once a week or so. Hot flashes that happen at night are usually called night sweats, and you may wake up with this hot feeling and cause it to be tired and sluggish during the day. Many women report this, and what we usually tell women is that you try to drink a lot of water, try to wear light clothing, and exercise also helps to decrease it. So I'll get to that as well. Other things can happen if you can have problems sleeping. Some women refer to having insomnia, that is trouble falling asleep, or they may wake up long before the usual time. They get up around 5 o'clock in the morning, although they're not going anywhere, and can't go fall back to sleep. The night sweats also disturb the sleep.
Mm.
Other thing can happen is the vaginal and the urinary tract changes. So when the estrogen, as we mentioned before, the estrogen is what the ovaries produce. When the estrogen decrease, the line of the vagina becomes thinner and drier and less elastic. This can cause problems during sex. So you can have dryness of the vagina during sex. You can have burning and pain during and after. Some women usually refer to this and they think they're having a yeast infection, but there's the usual discharge that is there with the yeast is not there, but they still have the itching and burning. So they come to say that they have a yeast infection when they usually don't have a yeast infection. It's just the dryness of the vagina. Um, Other things can happen is that you're more prone to having a vaginal infection as well, and you're more prone to having a urinary tract infection, because the urethra, that's a small tube at the top above the vagina where the pee pee comes through, it gets dry and inflamed and irritated, and as I said, put you more at risk of having a urinary tract infection. Other thing that can happen is they can have changes in the to the bone. Same hormone estrogen is responsible for making your bone nice and supple, making you a little bit less likely to have a fracture than a man. After this estrogen protection is gone, your risk of having a fracture increases. So a small amount of bone loss naturally occurs after 35 years for both men and women. But during the first 4 to 8 years after menopause, women lose their bone mass quite rapidly. And this rapid loss occurs decrease because of the same decrease in estrogen. And if too much bone is lost, then you increase your risk of osteoporosis. And osteoporosis is just a state where the bone is more fragile and easy to break.